Welcome to the Holistic Plastic Surgery Show, where we dive deep into the hottest trends in health, beauty, and cosmetic treatments. I'm Dr. Anthony Youn, America's holistic plastic surgeon. Have you ever thought about having a nose job? Well, if so, you're not alone. According to the American Society for Aesthetic Plastic Surgery, in 2016, there were almost 150,000 rhinoplasty surgeries performed in the United States. It was the sixth most popular cosmetic surgery overall. But there's a lot more to getting a nose job than meets the eye. Even though the nose is composed of just a couple bones and pieces of cartilage, it's the most difficult and technically demanding facial cosmetic operation that we perform. Rhinoplasty has the highest revision rate in all of cosmetic surgery. It also has the highest rate of patients who suffer from BDD, or body dysmorphic disorder. Well, in addition, botched nose jobs abound, and there are even plastic surgeons who specialize in fixing botched noses. So what should you do if you want to reshape your nose? Well, I have the answers for you on this show, so let's get started. My guest this week is one of the most respected and academically accomplished plastic surgeons in the world. He is a clinical professor, distinguished teaching professor, and founding chair of the Department of Plastic Surgery at UT Southwestern Medical Center, and founding partner of the Dallas Plastic Surgery Institute. His interests span the entire spectrum of plastic surgery, from craniomaxillofacial surgery to aesthetic surgery, and have resulted in over 900 peer-reviewed scientific articles. He served as president of the American Society of Plastic Surgeons. He's been a visiting professor to over 150 organizations and societies, and has chaired over 150 plastic surgery educational symposia worldwide. My guest has received top prestigious national research, teaching, and distinguished service awards from both national and international plastic surgery professional societies. He is editor-in-chief of Plastic and Reconstructive Surgery, the most prestigious peer-reviewed medical journal in the world for plastic surgeons. Well, I'd like to welcome my guest, board-certified plastic surgeon, Dr. Rohrich, to the Holistic Plastic Surgery Show. Well, thank you so much, Dr. Rohrich, for coming on the show. It definitely is an honor and a privilege to have a plastic surgeon of your stature coming on the podcast.
My pleasure.
Well, let's kind of get into it. So the subject of this show is all about rhinoplasty. And rhinoplasty is the sixth most common cosmetic surgery, according to the American Society for Aesthetic Plastic Surgery. Last year, nearly 150,000 people underwent rhinoplasty surgery. And when you and I think about it, really anatomically is just a couple of bones and a couple of pieces of cartilage. Yet we both know that rhinoplasty is one of the most difficult operations in all of cosmetic plastic surgery. And can you explain why that is? Because when you think about it, it shouldn't be. It's not like there's tons of different anatomy to deal with.
Yeah. Well, those couple of bones and those couple of pieces, they're attached to a human, and that's what makes it challenging. And everybody's face and nose is different. So, you know, it's intricate anatomy, and it is the most challenging thing we do because basically it's a surgery of millimeters. When you're moving tissue around in the breast or the other parts, you know, you can be off a millimeter, but in the rhinoplasty, if you're off a millimeter, it's the difference between a good result and a not so good result. So it's an art and it's a science.
Why is it then that this is one of the surgeries that obviously you've made a big name for yourself on? What has drawn you to this procedure in and of itself that you really enjoy performing it and changing people's lives by doing that?
I think because it's so hard and it takes so long to master. I mean, it's kind of one of the reasons I went into plastic surgery. You know, You have to do it a lot to get good at it. So it kind of epitomizes plastic surgery. And I love that. And you're never, ever going to get a perfect result.
No. And I think that's the difficult part. I mean, for me, I do perform some rhinoplasty in my practice. I don't do a lot of the difficult and the revision surgeries that you do, but I do enjoy doing it. But there is always that concern that I have of, even if I think it looks good, what if the patient doesn't? And I think that's the part of the surgery for me, I think that I have a difficult time dealing with.
Right. And sometimes, you know, it may look, you know, it's got to look good on the operating room table. You got to give it your best. And then sometimes it looks good for a year or two. And then you see the patient at 5 years and it doesn't look so good. And that's the learning process.
So can you describe, if somebody's listening or watching today and they're thinking, maybe I want a nose job. I mean, it's a very common operation. How does somebody go, what is the experience that they would have? They walk in the door, they meet you, they do a consultation, and the day of surgery and their recovery, what is that like? Can you kind of explain step by step what they go through?
Well, the day, when I first meet them, I tell them all about the procedure, the benefits and the risks. And I think the most important thing for the patient is to find a real rhinoplasty surgeon, someone who's an expert, someone who does it a lot, someone who speaks about it a lot, and who actually teaches others. And I think that's really important, because in rhinoplasty, you got to get it right the first time. Mm-hmm. And then we take photos, we do images, we talk about what's possible and also what's not possible. Mm-hmm. And then you got to get the patient making sure they understand what you can do and what you can't do. And I always go over all of those top 3 things again on the day of surgery. Mm-hmm. I ask them those same things. What are the 3 common concerns you have?
Mm-hmm. And so do you do it typically under a local anesthesia, general?
I usually use a general anesthesia. It's for maximal control, so I can concentrate on the patient's nose. I like to talk to patients before and after, but not during surgery.
Mm-hmm. And what's the recovery like? So the procedure, how long does it, I mean, obviously every surgery is different, but what's the average operative time that you find in your practice?
It's about 2 hours to do a primary. Sometimes it's a longer for a secondary revision. And the recovery is about a week or 10 days. Depends on what you have to do. If you have to do just, septal or internal nasal work, it's a week. Sometimes if it's longer, if you're doing a rib graft.
Mm-hmm. And when you're doing the procedure afterwards, they typically have a splint on? How long do they typically keep that on? And do you usually use packing as well?
No, I don't use packing. I use splints. Yeah, packing is really not a good thing to do. I use an external splint, a flesh-colored splint, an internal splint if I'm doing any septal work, but they can still breathe through the splint, because if you pack a nose, that is really torture.
Yeah. So when we do rhinoplasty surgery, for those people who are listening and watching today, there are 2 general ways to do it. There's the open technique and the closed technique. And most plastic surgeons, they favor one or the other. The open technique basically is one where you make an incision inside the nostrils and you connect it with a little incision. We call it the columella, but this part of the nose. And it allows you to literally lift the skin up off the nose and then do changes that you can actually see to the cartilage and things. A closed technique is when we make just 2 little incisions on the inside of the nostrils and kind of do everything underneath the skin. That's a technique that I typically do, but I don't do huge changes to when I do rhinoplasty. What do you favor? I know when I've read your articles, most of them have been with the open technique, correct?
Yeah, I like the open technique. I like to see what the deformity is. That way it gives me a better chance for fixing the problem. I mean, you can do it either way. I always tell people, do what's comfortable and what gives you the best result as a surgeon. But I like, it's like a sculpture. I like to see what I'm sculpting, and then I can put it back and see what it looks like and re-look at it. So I like the open technique, and especially for revisions, because everything is messed up. So
yeah. So revisions basically being patients who have had rhinoplasty surgery in the past and haven't been happy with the results. And I think that's one of the things for me in my practice that has always been a concern, because there are so many patients out there who've had not 1 rhinoplasty surgery, not 2, but 3, 4, 5. I've had patients come to see me, they've had 10 nose jobs and they're not happy, and they're having issues with breathing and stuff like that. How much of that do you see in your practice? So these patients who've had just more than even 2 operations?
I saw 3 today, and I just finished injecting one with a filler that had 5 rhinoplasties, and that's it. I mean, you can only do so much. And I tell people, you got to get it right the first time if you can. That's why you really need to see an expert if possible, because even with an expert, there's a revision rate. But if you don't get it right the first time, it makes it the second revision so much harder, 5 times harder. A primary rhinoplasty is a completely different operation than a secondary rhinoplasty. Much harder, and you can't usually get the result that you want.
Yeah, and I think the big thing that I get a lot of people when they've come to me for that, and they say, look, I've had a bunch of surgeries, I've got scar tissue. Can you operate to get rid of this scar tissue? And I try to explain to them that that's the opposite thing that will happen. Every time you operate, there's going to be more scar tissue that deposits. And so the answer technically is less versus more. Now, we do have a photo actually here that you sent us of a patient who had a revision rhinoplasty, but unlike what is done most commonly, where you bring them back to surgery and you do an open or a closed technique, you used an actual filler to reshape the nose. How often are you doing that nowadays?
Well, I think I do it not infrequently. In a patient like this that has had multiple procedures, is heart disease, is a diabetic, and is a smoker, all these things, I'm not going to operate on a patient like that because it's always about patient safety first. So if they've had all those things, especially if they had multiple procedures, I don't think a rhinoplasty is a safe thing to do. Mm-hmm. And sometimes psychologically, like a patient I saw today, after all those rhinoplasties, the last thing she wants and needs is another rhinoplasty. She just needs to have something that will make her nose look like it's somewhat normal again. And it lasts for a year or longer, and that's all they need.
When somebody is thinking about having their nose done and they read articles about this non-surgical nose job, before seeing a plastic surgeon, do you have any suggestions of when they look at their nose, whether they might be a candidate for that in advance before actually consulting? What types of patients, I guess, benefit from the liquid nose job versus
the liquid nose job?
Surgery?
Well, I mean, I know it's kind of a social media thing, but I really caution people about that. But some people want to wear it. They want to have a nose. They want to see what it looks like. And I actually do it not infrequently in Asian patients that actually request it. And then I do it in patients that want to have it. And then patients that have had so many rhinoplasties that you just can't have any more.
Yeah. And so do you find that you've been doing a lot more of the non-surgical, the fillers for the noses?
Yes, I do. Every week I probably do 2 or 3.
Really? So you're actually seeing then an increase in those percentages of people doing that. What type of filler do you choose for that?
The best filler is a hyaluronic acid filler. It's a biodegradable natural filler that actually you can reverse if needed. So you don't want to use a permanent filler in that area because there's really not much soft tissue. And you can mold a hyaluronic acid filler. And if you do surgery, it's not a problem. Mm-hmm. So it's a safe FDA-approved filler. So
do you typically use Restylane or Juvederm? Is there a favorite that you have, or does it depend on the patient?
I use both. I like Restylane because it's a little more structural, but you can use either one. I think that I like Restylane because I can mold it, and I can mold it. I can actually even reconstruct the internal nasal valve. I mean, you can do amazing things with a filler. You can have them breathe better. You can reshape the tip.
Yeah, my concern always with the injection of filler to reshape the nose is the concern about intravascular injection. The nose is very vascular. We know that there are danger zones of the face. Is that something that you've ever, anybody ever called you about, that they've had that issue? Have you ever seen that in your practice at all?
Oh yeah, I see it. I've seen it several times, and that's why I'm really worried about. I mean, I really think that rhinoplasty surgeons, plastic surgeons, or facial plastic surgeons should be doing this. I think if you're not in that arena, I really hesitate to teach people to do it because of what you just said, Tony, because you could lose the nose, you could lose the tip. And so if you're going to do that, you got to make sure you know how to reverse it, and you got to do it immediately. Like the patient I just did, I'm going to watch her for 15 minutes before she goes.
Yeah. So what we're talking about is when an injectable filler is actually injected into a blood vessel accidentally. I mean, it's never done on purpose. That the part of that body that is supplied by that blood vessel could literally have no blood supply, and that can actually cause the area to die, or we call necrose. And that's the big fear we have when injecting filler. And just like you, I only use hyaluronic acid fillers. When we, in my practice, there is nothing but hyaluronic acid fillers. And I have seen those situations where we've had to pull out basically the antidote. It's called hyaluronidase. Right. And as a surgeon, if we inject around that area, it will literally, literally dissolve it away within minutes. It's amazing what it can do. But the concern that we have, obviously, is when you're injecting these areas that are so vascular that even a great doctor, a doctor who's careful, this type of thing can happen. Are you using cannulas at all when you're injecting these fillers?
I've used cannulas in the past. I usually use needles, and I stay in the midline, and you stay deep. I mean, and that's exactly what to do. They're away from the vessels. But
So you've been preferring the needles.
yeah, I think it's just what you're used to.
Yeah. So, we've kind of talked about that there are patients who've had multiple nose jobs. You see lots of those revisions, secondary, even tertiary procedures in your practice. One of the things that struck me several years ago, I was at a talk by a very prominent rhinoplasty surgeon, and he gave a statistic that I thought was kind of frightening. But the percentage of his patients that have dysmorphic disorder, or BDD, and the fact that so much of that centers in our patients around the nose. Now, I know you do a wide variety of plastic surgeries. I've read your articles on facelifts, on the nose jobs, on even breast surgery. In your practice, do you see a lot more of BDD, this body dysmorphia, in rhinoplasty patients versus the other patient populations that you see?
Yes, I see it more in noses and faces, and some of them are very challenging, and they're very difficult to pick out sometimes. But if I recognize it, I really don't operate on those patients if possible. But it's a challenge because they're never going to be happy. But there are some things you can do to detect them.
Yeah, and what are some of the signs that people may show if they do have this body dysmorphia? They come in for a nose job. What are some of the things that you look for?
Well, one of the things is that they've had multiple procedures. They're never happy. And sometimes they bring in, I had a patient recently from LA that brought me a whole PowerPoint over 5 different procedures done. And she pointed out things, some I could see and many I couldn't see.
Yeah.
And she was very kind to her previous surgeons, and some of them who were very famous rhinoplasty surgeons. But in the end, so many of the things she talked about, you can't fix.
Yeah.
And yet she wanted to have that done because it would change her life. It would make her better. No, surgery doesn't make you a better person. Can't get you that job. So
exactly. I mean, it's not a way to make you happy. But I see the same thing sometimes, is that patients come in and they say, well, don't you see this? Don't you see that? And I literally will just tell them, look, I literally don't see it, and I can't treat something that I can't see.
Ditto. That's exactly right.
Yeah, I mean, so that's, I think, the difficult thing, I mean, is dealing with BDD and knowing that so many rhinoplasty patients, I think much greater percentage of rhinoplasty patients over, let's say, our breast enhancement or tummy tuck patients that do suffer from that. And one of the hallmarks of BDD is technically not knowing that you have it. And I think that's why it's so difficult to treat them, is because ideally we'd love to say, hey, you know what, you're not seeing what is reality, but this is their reality. And that's, I think, the hard part about it.
Right. And there was a recent study that came out of Hopkins that said that, we can do a test. We can find out if they are around, if they have it. And then you tell them, if you tell a BBD patient that they have it, first of all, they'll be very angry at you and they'll leave. Yeah. It doesn't work that way.
No.
It's a challenge.
Yeah.
Most of the time, you shouldn't be operating on patients with BBD. They have other issues to deal with.
No, exactly. And ideally, if you can send them to counseling and a therapist and psychiatrist, that's great. It's just, it's hard to get the insight so that they know they have it. One of the big things that, I know you're involved a lot in social media, and people have been talking a lot about people wanting a famous celebrity nose. And Ivanka Trump is in the news nowadays, obviously with her dad being the president. Have you ever had anybody ask for Ivanka's nose?
I have. I've had a few people ask me for her nose and her cheeks.
And her cheeks. She's got good cheeks.
Yeah, she's got good. She's an elegant, beautiful woman. And, I think because she's so much in the media now because of her father, it's not uncommon. It used to be, J-Lo and others, Kim Kardashian. And so I always tell people that nose looks good on her beautiful small face, but that nose is not going to look good on you. And so that's why I think computer imaging is so important. Mm-hmm. Every face is different. Every nose is different. So I really try and move them off of that. Mm-hmm. And most patients are fine with that. But if they want to have like a nose and a face like Ivanka Trump, that's a problem.
Yeah. So
I'm not going to do that.
When people come in and they're interested in a rhinoplasty, do you use computer imaging? Do you use like the 3D imaging like Vectra? Or how do you tend to try to give them an idea of what they're going to get?
You can use, 2D, 3D imaging. I think the most important thing is that you really should image patients because they need to see educationally what they potentially can look like. Mm-hmm. I think it's a hallmark and essential part of a rhinoplasty consultation. They need to see what potentially they can look like. And I always tell them, it's just an educational view.
Yeah.
Nobody, I tell them, I'm not God. I operate with a scalpel, not a wand, and that I cannot give them a perfect result. But it's very important for them to see what you can do and what you can't do. Mm-hmm. And the patient, by and large, that comes back and says, I want 17 different views of that, I'm going to send them to you.
And they'll look and say, well, you don't do a lot of revision rhinoplasty.
No, what I'm saying is then they're not realistic. They have to understand that I actually, when I do a computer imaging, Tony, I actually underdo it. I show them what's kind of an average result. Because, if you sell a patient with a computer image, that's going to come back to haunt you.
Now, do you give them a copy of it when they leave your office?
Absolutely. I send it to them by email, but it says these are educational views. Yeah, I just tell them that, most of the time, actually, the result is better than the educational review because I don't like give them a wow. If you're selling somebody for a rhinoplasty with your computer image, that's a bad thing.
Yeah, and that's, I think, my fear because I do have, I use UltraImage, which is a very simple, straightforward, two-dimensional program. But I don't send them a copy because I don't want them to feel that this is a guarantee of this is what their result will be. And even if I don't tell them, even if I tell them, look, it's not a guarantee, everybody heals differently. Right. That's always a fear is, well, my nose doesn't look like this. And it's like, well, you had swelling, you had a little scar tissue.
But you make sure you imprint it on your image. I mean, it's just a way of how you handle it. And I think you're doing the right thing. You're just saying this is an educational view. Yeah. But I sometimes see images that are brought in saying this doctor said this, and the image looks amazing. Yeah. I never give them an amazing image. Mm-hmm.
Well, anybody can Photoshop a nose to look great. That's the thing.
Right. Yeah. Right. No, but operating and doing it.
That's a whole other story. Yeah. So, like, if you see a wide range of patients, and one of the trends that you hear, and it's something that alarms me, is the number of teenagers that are having cosmetic procedures done. And I think part of it is due to social media. There's so many teens that are big on social media, and they're watching Snapchat, and they're watching these surgeries, and they think, oh, I can have that done. There are black and white issues of when is the right time to do it, but there also, I think, is a lot of gray of, let's say you have a 14-year-old who has a big bump on her nose and she's being made fun of. What are your thoughts as far as teenagers having rhinoplasty surgery?
I think it's in the right patient, and especially with social media. Bullying is unbelievable now with social media and in the era of selfies. Yeah. I think these kids are really, I have children that are teenagers. I think they're under the spotlight all the time. So I really think in the right patient with counseling, some of the teenage rhinoplasties I've done have been transformational to these kids, especially to girls, because, girls are hard on each other. And it's transformational when you do a subtle rhinoplasty to improve their shape, make them smaller, get rid of the bump. It's unbelievable what it does, for them. And bullying and the selfies era have transformed this whole subgroup. So I do actually a lot of teenage rhinoplasty, males and females. In the 15 to 18 to 19 age group, I do. And it's been those patients are amazing.
It's been rewarding. It's a difficult one. I mean, it's something I have a hard time with, I think, because I think, okay, you've got a child who's getting bullied, who's a victim. And shouldn't we then, for me, I look at it as a parent, it's like, shouldn't we change the attitude and the actions of the person who's doing the bullying? Because that's what's actually wrong. Like, it's nothing wrong to have a big bump on your nose. It's just, it's wrong that people are treating you that way. So I think that's my issue with it, is it's hard for me to, it's like, I think I look at it from more of an idealistic perspective of, and it's interesting because there was a news article not that long ago that I was quoted in, and it was a lot of the majority actually of patients sided with the parents of the child who had the surgery, even though I was actually the voice of dissent saying, I don't think it's the right thing. I said, look, the attitude that needs to change is not that this patient's nose doesn't necessarily need to change. The darn bullies, they're the ones that need to change.
I totally agree with you, but good luck in trying to do that. I mean, you're going to go and bully the bully. I mean, it's true. And, like in my daughter's school, bullying has actually become pretty prevalent, especially with social media.
Yeah, I know.
And it's not the traditional bullying on the playground anymore. It's social media.
Yeah, and I don't fault surgeons at all for doing it. I completely understand. Like it is the way to solve. I just wish it didn't have to be that way. I think that's kind of how I think. And
I agree, Tony.
But,
you're a good idealist.
All right. Well, you've seen it all. You've done it all. You've been in this business for a long time. And one of the things I'd love to hear from you is just a story of one of your most memorable or difficult rhinoplasty patients. Something that's, we all have as physicians, we see thousands of patients. Yet there are always these handful of patients that always stick in our mind, whether it's a good story, whether it's something great that happened to somebody, or maybe something that's tragic, maybe something that really, we felt for. Is there a story that you'd like to share, that you could share with us about a memorable patient? I've
got several. I mean, one of them is actually about one of the bullying ones, but I've shared that somewhat with you. But I think one of the most memorable patients was a physician's wife that actually had multiple rhinoplasties, and she had so many rhinoplasties that she lost the tip of her nose. Her skin was gone, and it was a disaster. So she needed to have what was called a forehead flap to fix her nose, and also a rib graft to reconstruct her dorsum and her rims. She had really been destroyed. She'd become a recluse. So I basically had to do both a rhinoplasty and a nasal reconstruction. So I did one of those, what's a forehead flap that brings the skin down from your forehead on your nose, do a rib graft from your rib cage, and then reconstruct her nose, and then fix the inside and the outside of the nose. And that was phenomenal. And she, came out,
with a nice result. God bless you for doing that. That's a huge thing. So Dr. Rohrich is talking about what's called a forehead flap, where when typically we use it when people have cancer, skin cancer, and they lose a part of their nose. And so in order to recreate the nose, we actually take skin and the underlying tissue from the forehead, move it down, and literally connect it for a good 10 days to 2 weeks before we sever it and it heals in place. I've done the surgery before, but never for a rhinoplasty revision. That's a big deal. And the patient did well.
She did great.
Did she hide out how long did you keep the bridge together?
About 4 to 5 weeks. And,
that long?
She'd been hiding out for about 3 years. So after we inset it, she was back in the public eye in 2 months. It was amazing.
Wow.
It's been amazing.
That's great. Well, it's been such a pleasure having you on the Holistic Plastic Surgery Show. Could you give our listeners and our audience just one takeaway? I've got your ear here. Dr. Rod Rohrich, his website is drrohrich.com, Rohrich, drrohrich.com. He's on Twitter at Dr. Rod Rohrich, on Facebook at Dr. Rod Rohrich, and Instagram, rod.rohrich. Dr. Rohrich is in private practice in Dallas, correct?
Yes, right.
In Dallas. He performs all sorts of cosmetic procedures. We're talking about rhinoplasty today, but he is a facelift expert as well as an expert in so many other cosmetic procedures, and somebody that I have looked up to for over a decade in private practice. Wow. So you have affected my practice by literally me learning from you and all the journal articles that you've written. So knowing that we have such an esteemed plastic surgeon here, could you give us one word of advice, one piece of advice before you leave today that we can take? And we won't be disappointed with whatever you have to say, just because you share so much with us.
Well, I think, that there's several things. I mean, one is, when you're going to have plastic surgery, find an expert. Find someone who's got experience, who's got the expertise, and who can show you exceptional results. I think if you want to be happy with plastic surgery, just do your homework. Because everybody's famous on their own website. We all know that. And I think just the practical advice on avoiding plastic surgeons is don't smoke, stay out of the sun, use sunscreen, and Retin-A. If you do those things, you won't see you or I for many, many years, as you know.
I think that's great advice. Well, thank you so much for coming on the show, Dr. Rohrich. It really was a pleasure.
You bet. It's my pleasure. Take care.
I'm Dr. Anthony Youn, America's holistic plastic surgeon. This is the Holistic Plastic Surgery Show. We'll see you next week.
Take care.
Do you want to look 10 years younger without having surgery? Well, my best-selling book, The Age Fix, will tell you how. I spent the past 17 years learning the secrets to turning back the clock and have written all the best of these secrets in this book. This includes the Age Fix diet, simple changes to what you eat that can make a huge difference in your appearance. I'll share with you a simple skincare routine to keep aging and wrinkles at bay. And I'll share with you the best secrets to treat every single beauty and aging problem there is, from age spots to wrinkles, saggy skin to bad breath, saddlebags to hair loss. And almost all of these can be effectively treated without surgery. So are you ready to turn back the clock and kick Father Time's backside? If so, check out the Age Fix. Now, if you purchase it on my website, dryoun.com, you'll get over $10 off the cover price, free shipping, and you'll receive several free gifts, including a bonus chapter that you can only get by purchasing the book there. Thank you for making the Age Fix such a huge success.